brachial plexus injury. So most important injuries, two injury আমরা মনে রাখবো. There are lots of causes of injuries, but you should keep it in your mind. Erb's palsy and Klumpke's palsy. Erb's and Klumpke's. Or the spelling of Erb's, E-R-B-S,
RBS.
Erb's. But uchcharonta Erb's, like you. Okay, so just keep it in your mind. Erb's is for upper, and E is the topmost alphabet, and Klumpke's K is the lower down alphabet. Okay, so Klumpke's is lower chord, lower root, and Erb's is upper root or trunk injury. Clear? So Erb's palsy, তে কোন দুইটা root অথবা trunk involve হয়? Which root or nerve is root or trunk is involved? C5, C6. If C5 and C6 is injured or compressed, it causes what? Erb's palsy. Most common cause of Erb's palsy is birth injury. Say, for example, you see this picture. During delivery, this guy is putting pressure on the upper chord of the brachial plexus. Here, say, for example, this baby has gross cephalopelvic disproportion. This baby has gross hydrocephalus or shoulder dystonia. So, তখন যেটা হয়, or forceps delivery, যেটা হয়, there is compression in the upper root or trunk, especially upper root, C5 and C6. It will cause কি করবে? Erb's palsy. Okay. Other cause কি হতে পারে? Most common is birth injury,
RTA,
shoulder trauma due to RTA. যদি কোনো কারণে base of the axilla তে, if there is any penetrating injury in the base of the scapula or base of the axilla, ঠিক আছে? Clear? So these also can cause Erb's palsy. ঠিক আছে? So now look at this figure. This guy has developed Erb's palsy. What's happening? I will discuss this one later. Shoulder rotated forward. Affected arm diminishing length and girth due to why? Muscle atrophy. So muscle atrophied in the affected arm, and you see here, এখানে কি হয়েছে? Hand points backwards. That means hands pronated, and this one is called weighted tip deformity. Clear? So again, I'm telling, just look at the picture. Affected shoulder rotated forward. Affected arm diminished in length and girth. Okay. Muscle atrophied in the affected arm, and you see here the hand position is, the hand points backwards. That means pronated. Okay. And you see the arm is a little bit shorter in comparison with the normal arm. Shoulder is rotated forward. So again, I am telling, in case of Erb's palsy, the pathology is C5 or C6 root or trunk. Clear? Okay. What are the muscle here injured? C5 and C6 থেকে কোন nerve originates from C5 and C6? Two nerves. Axillary and musculocutaneous. Axillary supplies the deltoid muscle, and so there should be gross deltoid atrophy. Clear? Clear? So what's the function of deltoid? The function of deltoid is arm abduction. 15 to 90 degree or 15 to 100 degree.
90 degree.
So this guy will quite unable to abduct his hand, isn't it? And you see here, and the other affected nerve will be the musculocutaneous nerve. And what's the muscle supplied by musculocutaneous? Biceps brachialis and coracobrachialis. So three muscles is involved in this palsy. Number one is deltoid, which is supplied by axillary nerve. Other two muscles, biceps brachialis and coracobrachialis, is supplied by musculocutaneous nerve. So যদি আপনাদের এক্সামে আসে in Erb's palsy musculocutaneous nerve is involved, true or false?
True.
True.
In Erb's palsy there is maybe gross atrophy of biceps brachialis.
True.
True.
No, false.
False.
Why false?
সবগুলোই তো অ্যাট্রফি হবে,
Sorry, true.
তিনটেই তো অ্যাট্রফি হওয়ার কথা।
True.
এই যে এখনই পেজ লাগিয়ে ফেলতেছেন, you guys are making twisting. Why? I have already told three muscles will be involved. Why shoulder became atrophied in comparison with the normal arm? What's the reason behind that? Because due to involvement of these three muscles, তাই না? এই কারণে তো শোল্ডারটা in comparison atrophy হয়ে গেছে, deltoid atrophy, biceps brachialis and coracobrachialis involved, তাই না? So there will be gross muscle wasting. Okay, fine. So clinically কিভাবে বুঝবা? How will we diagnose this one is clinically? This is a case of Erb's palsy. Patient কে যখন, when we ask the patient, would you please abduct your hand? তাকে যখন তুমি হাত 15 to 90 degree পর্যন্ত or more than 100 degree পর্যন্ত abduct করতে বলবা, sorry 15 to 90 পর্যন্ত abduct করতে বলবা, this guy will quite unable to abduct his arm. Clear? Due to deltoid palsy. So loss of abduction of the arm is a diagnostic feature of deltoid palsy, and there will be loss of elbow flexion due to paralysis of which muscle?
Brachialis.
Biceps brachialis.
Biceps brachialis.
ঠিক আছে? Clear? So there should be significant wrist deformities like weighted tip posture, hand points backwards, pronated, shoulder rotated forwards, short arm in comparison with normal arm. Clear? Most common cause is birth injury. There may be blah 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 like cephalopelvic disproportion, hydrocephalus, shoulder dystonia. So when the shoulder is quite unable to pass in short birth canal, okay, the obstetrician may use their hand or instruments. So this may create pressure on the base of the axilla or root of the neck, causing Erb's palsy. খুব simple. ঠিক আছে? Okay. Why there is muscle wasting? Due to neurological deficit. Small worsen of the hand, wasting, deformities, guttering. Okay. So sometimes it's called the flat shoulder. You see here, actually in our shoulder there is a curvature. This curve is produced by which muscle? Deltoid muscle. So when it becomes atrophied, this is called the flat shoulder or flat shoulder due to deltoid atrophy. Sometimes there is a syndrome associated with Erb's or even Klumpke's palsy or any root or trunk compression, which is called Horner syndrome. কখনো কখনো when there is injury in the upper or lower brachial plexus, that means upper lower trunk of the brachial plexus, কখনো কখনো পেশেন্টদের Horner syndrome associated থাকে. Can anyone tell me what's the reason why there is Horner syndrome?
Meniscus tumor.
Karan, why? You see here, this is the brachial plexus, isn't it? You see, this is the brachial plexus, and the brachial plexuses are strongly related with sympathetic ganglions, isn't it? Sympathetic ganglioনের সাথে brachial plexus closely related থাকে. So if there is any injury in the brachial plexus, there's potential chance of sympathetic ganglion or sympathetic nerve damage also. So that's the reason why sometimes upper or lower trunk or root injury of brachial plexus is associated with Horner's syndrome. বুঝা গেছে? Clear? Okay. So, what is Horner's syndrome?
Ptosis.
What are the features of Horner's syndrome? Horner's syndrome হচ্ছে পামেলা অ্যান্ডারসন। অবশ্য তোমরা এখন পামেলাকে চিনবা না, যাই হোক। Okay, fine. So P for ptosis, A for anhydrosis, M for meiosis, E for enophthalmos, L for loss of craniospinal or craniociliary reflex, ঠিক আছে, আর A for anisocornea. Clear? So this is the features of Horner's syndrome, Pamela. Okay. So there is small pupil which is called meiosis. So loss of sweating from the affected side of the face, which is called anhydrosis, and muscle around the eye shrinks, which is called enophthalmos. So এই জিনিসগুলো মনে রাখতে হবে। So Horner's এ যেটা হয় ptosis, meiosis, anhydrosis তো আমরা মনে রাখি, সাথে বাকিগুলোও মনে রাখতে হবে। That means we have to know all the features by Pamela, Pamela, Pamela. Okay, clear? So now, can anyone tell me what's the basic difference between Horner's syndrome and cranial nerve three-lesion? Horner's syndrome versus cranial nerve three-lesion.
Horner's syndrome
Horner's partial ptosis है,
Horner's
partial ptosis হবে।
why? কেন?
এখানে ওই যে আইয়ের সুপিরিয়র টার্সাল মাসেলের ইনভলভ হয়, আর আপনার থার্ড ক্রেনিয়াল নার্ভ
Superior tarsal বলে সমস্যা কি?
তো উইক মাসেল
Yes.
টার্সালটা।
So in Horner's syndrome, the affected muscle is superior tarsal. It's a weak eye muscle. That's why the ptosis is partial ptosis. But in case of cranial nerve three-lesion, কোন muscle involved হয় cranial nerve three-lesion এ?
এটা তো হচ্ছে লেভেটর পালপেবিস
Superiorlis. In cranial nerve three-lesion, the affected muscle is levator palpebrae superiorly. This is the strongest muscle. Levator means এটা আমাদের, that means এটা আমাদের কি করে, আইলিড কে লিভেট করে। লিভেটর মানে কি, উপরের দিকে উঠায় রাখে, pulling forwards. So this is the strongest muscle, and if it paralyzes, the ptosis will be complete ptosis. But in the Horner's syndrome, the affected muscle is superior tarsal muscle. This is a little bit weak muscle. Number one differentiating point. Number two,
dilated pupil থাকবে cranial nerve,
dilated pupil,
out of the constrictor is complete.
both light and dilated consensual light reflex absent থাকবে নাকি?
জি।
Okay, fine. Cranial nerve three-lesion. আর
ওটাতে থাকবে constriction থাকবে is complete.
small pupil থাকবে, fine. আর এটাতে কি হবে? I will be down and out. Why down and out? In case of cranial nerve three-lesion, I will be down and out. Why out? Because the pulling effect of LR6, lateral rectus, because cranial nerve 6 is still intake. Medial rectus is paralyzed, isn't it? Because it's supplied by cranial nerve 3. The lateral rectus is active. It will pull the pupil eye
downward and
down and out. Clear? Clear? So these are the basic difference between Horner's and cranial nerve.
the mydriasis থাকবে একটা meiosis.
Yes. And একটা হচ্ছে dilated pupil, that is mydriasis. In case of cranial nerve three-lesion, another one is
Horner's meiosis.
also meiosis. Okay, fine. So we have discussed lots of things regarding Erb's palsy. Now let's talk about Klumpke's palsy. So what's Klumpke's palsy? Anyone?
lower brachial plexus injury.
Lower brachial plexus injury. Lower means
C8T1.
C8T1.
C81. That means lower root or trunk যদি lesion হয়. So trauma in the root of the axilla due to pressure effect. Same here, birth trauma. You see here, এই বাচ্চাটাকে হাত ধরে টেনে বের করতেছে, isn't it? Sudden pulling. So there will be pressure in the root of the axilla, especially in the lower trunk of the brachial plexus. So another cause is birth trauma. Affected C8T1.
T1.
Okay. Okay. So mainly which nerves involved here?
Ulnar nerve and median.
Ulnar nerve and median nerve. Ulnar nerve and median nerve. যদি whole C8 and T1 involved হয়, there will be complete claw hand. There will be complete claw hand. Okay. But if the median or ulnar nerve involved, there will be two types. Number one is sign of benediction. Can anyone tell me what is sign of benediction? You see in my, see here,
So, Christian Pope.
sign of benediction. This one, this type. That means the Pope is blessing. This one is called bishop blessing symbol. Why this happen?
Median nerve pulse.
Median nerve supplies this portion. Median nerve supplies, look at here, median nerve supplies. Median nerve supplies
Median 3.5.
Median.
median 3.5, isn't it? And this one is the
Ulnar.
ulnar part. So when you ask the patient to make a grip, due to lesion of 3.5, he will quite unable to make a fist. So the lesion should be like this. That means bishop is blessing. This one is called sign of benediction, Pope sign, or bishop blessing symbol. তিনটা কথা বললাম, 3 things. What? Sign of benediction, Pope sign, or bishop blessing symbol. Okay. So median nerve এর কাজ কি? It supplies the flexor group of muscles, isn't it? Flexor group of muscles. So when it paralyzes, causes this source of lesion. Okay. When you ask the patient to make a clenched fist, he will quite unable to do it, isn't it? So this one is median nerve lesion. So median nerve lesion usually, যদি আমি যেটা বললাম, if there is complete lesion or complete cord compression in cervical 8 or thoracic 1, there will be complete claw hand. If there is compression or fracture in the mid or upper arm, that means median nerve lesion এ যদি proximal lesion হয়, proximal means upper lesion, that means mid অথবা upper arm এ যদি lesion হয়, you will get this source of sign, that means sign of benediction. আর ulnar nerve এর ক্ষেত্রে distal lesion, that means lesion in the lower forearm, so you will get this source of claw hand. Clear? That means paralysis of the this portion. যখন পেশেন্টকে তুমি, when you ask the patient to make a fist, he will quite unable to make a fist, just like this, because the extensor group of muscle will pull. অর্থাৎ এদিকে এক্সটেন্সর পুলিং হবে, এক্সটেন্সর গুলো পুল করে টেনে রাখবে, সে কি করতে পারবে না, will quite unable to make a fist.
Flex.
So this one is called ulnar variety of claw hand. This one is called median variety of claw hand. Ulnar variety of claw hand caused distal or proximal lesion.
Distillation.
Distal.
Distal lesion means lesion in the distal forearm or hand. Clear? Or proximal lesion means if there is any fracture in the upper arm or mid arm or upper forearm. Clear? ঠিক আছে? And if there is complete lesion, this will called both ulnar and median compression, and this will cause absolute claw hand, just like this. This, see, this claw. This claw
Pope sign.
by
Median nerve.
Median nerve.
Median nerve.
this claw by,
Ulnar nerve.
okay. Some confusion? Is there any confusion? Is there any confusion?
No,
So
No.
clamp is paralysis, full claw hand, and you see if there is compression in the C8 and T1, you see there is small muscle wasting along with guttering. That means median এবং ulnar nerve যদি lesion হয়, if there is lesion of median and ulnar nerve, there will be gross muscle wasting. Usually single nerve compression এ এত বেশি muscle waste হয় না, but যদি trunk involved হয়, if the trunk is involved, there will be gross muscle wasting. Clear? Clear? So this one is absolute claw hand, both ulnar and medial palsy due to lesion of trunk, word trunk, C8 and T1. This one is median claw hand and this one is ulnar variative claw hand. Clear? So sign of benediction happens due to distal lesion of median nerve. True or false?
False.
Sign of benediction or bishop blessing or
False.
pope sign is caused by mid or upper arm lesion of median nerve. True or false?
True.
True. Okay. This source of claw hand is caused by proximal lesion of ulnar nerve. True or false?
False. False.
Okay. Clear? So that's it. Another cause is same. There may be Horner's syndrome, same cause. There may be other causes with birth trauma.